Good morning. I'm Hillary Armstrong. I'm a public information officer with the County of Santa Clara. Thank you for joining us this morning. We are here today to provide you with updated information about the expansion of vaccine access and eligibility in Santa Clara County. We will begin by getting an update from Dr. Jennifer Tong, the Chief Assistant Medical Officer with Santa Clara Valley Medical Center. Then we will be joined by James Williams, County Counsel for the County of Santa Clara, and Supervisor Otto Lee, Supervisor for District 3 of the County of Santa Clara Board of Supervisors. We will begin with the English and American Sign Language portion of our press conference, followed by question and answer session. Then, to let you know, our speakers will repeat the questions for our Facebook Live audience. They will be followed by statements from the podium in Spanish, Vietnamese, Chinese, and Tagalog. Thank you very much. With that, I want to hand it over to Dr. Jennifer Tong.
Good morning. I'm Dr. Jennifer Tong, Associate Chief Medical Officer for Santa Clara Valley Medical Center. I'm here today to highlight the expansion of vaccination locations and growing capacity for vaccinations throughout the county. Santa Clara Valley Medical Center, our county health system, is leading the way to increase access for our community. To date, Santa Clara Valley Medical System has provided 32,352 first doses and 6,594 second doses. Our system alone has established 5 vaccination sites, including 2 mass vaccination sites, one here at Burger Drive and one at the Santa Clara County Fairgrounds. Next week, we will open an additional location in Mountain View. Our system alone vaccinated more than 3,000 individuals this Monday, more than 4,000 this week on Tuesday and Wednesday each, more than 5,000 yesterday, and we have more than 6,000 appointments scheduled today. So we are ramping up very quickly. The site here at Burger Drive, opened on Tuesday, has daily capacity for more than 1,300 vaccinations. This builds on the capacity at our Valley Medical Center clinics and the fairgrounds, where we can serve more than 1,800 people per day. We expect to open a 3rd mass vaccination site with even greater capacity. The biggest constraint we are facing right now is the availability of vaccine. We really need a stable and predictable supply to be able to predict our capacity and expand our capacity in the future. Due to this limited and unpredictable supply, we continue to need to limit eligibility for vaccination. Currently, our Santa Clara Valley Medical Center sites are vaccinating any healthcare provider who lives or works in Santa Clara County, as well as individuals over the age of 75 who live here in Santa Clara County. As soon as more vaccine becomes available, we will increase access further. For those who are eligible currently, we encourage you to go to sccfreevax.org to schedule an appointment. With that, I'd like to introduce our County Counsel, James Williams, for an overview of where we stand overall in our county with regard to vaccine eligibility and distribution.
Thank you, Dr. Tong. Good morning, everyone. I'm going to speak for just a few minutes about the overall vaccine situation. And we recognize we're in an environment of changing federal and state information daily. And it's extraordinarily frustrating for us here locally and, of course, for residents in the community. We learned a few days ago, for example, that the federal government was going to release stockpiles of vaccine that were being held for second doses. We learned this morning no such stockpile exists. This throws into chaos expectations around vaccine delivery. Similarly, at the state level, guidance has changed almost on a daily basis, sometimes even more frequently. And we're operating in an environment where here locally as a county, we don't have visibility into what all vaccine providers are doing, what vaccine they have on hand. That's because some vaccine providers are getting vaccine directly from the federal government. such as the CVS Walgreens partnership that is supposed to be responsible for vaccinating the most vulnerable residents at our long-term care facilities. These are the folks with the highest fatality rates, one of the most concerning populations that needs to get vaccinated right away. That's a federal program, a federal partnership, and we don't have visibility into what's happening there. The state directly distributes vaccine to what they call multi-county entities, such as Kaiser and PAMF. Kaiser and PAMF are responsible for the majority of Santa Clara County residents. The majority of our residents are their patients, and we don't have full visibility into what they are doing. Nonetheless, our commitment here locally is twofold. First, that the county health system is going to continue to do everything it can, more than its share, as it already is, as it already has, as Dr. Tong has already described, the over 32,000 first doses that have been administered by the county's own health system, the capacity that's ramping up by the thousands daily this week and will continue to ramp up moving forward, the 2 mass vaccination sites directly operated by the county's health system. That work is just phenomenal, and I want to commend Dr. Tong and the entire team that's working on standing up all those sites and operating them, the county disaster service workers, the entire strength of the county's health system, the investments that county residents made over many years in the acquisition of 2 additional hospitals, the capacity that we've had to have a public health system that can actually deliver shots in arms in a way that very few governmental entities in the United States can do. And so that capacity will continue to ramp up. We're going to continue to try to get the data that we need from entities like Kaiser and PAMF. We know people want to know that information. And as soon as we can get that and we can put that together, we'll put that on our website and make that available. But it's been a challenge. You know, this pandemic has been one of such extraordinary challenges across the board under a federal administration that, frankly, for 4 years has seemed to mess basically everything up. And that's been true on the testing front. It's been true on the containment front with this virus. And it's turning out to be true here on the vaccination front. And we're hopeful that with a new administration comes, individuals age 75 and older. We understand Kaiser's making some limited appointments available for those 65 and older, but the other providers in the county is for persons age 75 and older. Why is that? Well, you heard Dr. Tong describe a few moments ago, our biggest limitation is the number of vaccines that are coming in the door. And when we schedule appointments out for several days in advance, these slots get all filled up. People expect that when they show up, there's a vaccine to actually administer into their arm. And so the vaccines that we have, they come, you know, we don't get shipments every day. They come in bulk quantities, and then they get expended over the next few days based on the scheduled appointments. So we're going to continue to expand our local capacity. We're going to continue to urge the state and federal government to provide more vaccines and a more predictable supply of vaccines so that we can continue to schedule people out. And we're going to continue to provide the best information that we possibly can, and it'll get more and more robust as we get better reporting from other providers at our website, sccfreevax.org. With that, I'm going to turn it over to Supervisor Otto Lee from the Board of Supervisors.
Thank you, James L. County Council. My name is Otto Lee, one of the supervisors in District 3 of the Board of Supervisors. Good morning. Very nice to have honored to be speaking with you today regarding our COVID response and our vaccination situations. As we all have heard in the news, the average death rate of the United States is now 4,000 deaths a day. As much as people are so sick and tired of this pandemic, we're all getting really antsy, want to go out and do things that we're so used to do. This is absolutely the worst time to be going out and doing get-together. We are now finally feeling the impact of Thanksgiving and Christmas get-togethers, and that's why these numbers are so high around the nation. The state of California now is also in one of the worst state in terms of Southern California. You can see that there really is no COVID or hospital beds, and it's now also affecting us right here in Northern California and Santa Clara County as well. Our ICU beds numbers are often below 10% on a daily basis. And we could see that this number is not going to plateau unless we all work so hard together to stay socially distanced, wear masks, and unless absolutely necessary, please don't go out and gather. One thing I would say is that it is the light of the end of the tunnel, proverbially, is really at hand. The vaccines is finally here for the past month. It certainly took us a while to get the ramping up of the program going. But the good news I have is that we are getting up to this 6,000 vaccinations capacity a day just from our Santa Clara County alone. The County of Santa Clara, with the Valley Medical Center, O'Connor, St. Louis, and all the health providers led by Dr. Tong here, has done a really amazing job for the short amount of time during vacations, during all these holiday period, to be able to ramp up literally 7 days a week in order to get these facilities opened. Right here in Burger Drive, as of Wednesday, those who are over 75 years old has become eligible. I was able to sign up on Wednesday morning on the website like everybody else, and my mom actually came by here and actually get vaccinated in the afternoon. The process was very smooth, and I'm glad that she's been protected now. She's almost 80 years old, and I do think that this program is working very well. The problem we have at the end of the day is logistics. We don't have enough vaccines. The federal government, as some of you, can make a huge difference. Nobody wants to talk about death. Nobody wants to talk about this pandemic anymore. And nobody really wants to stuck at home and not able to go to school. I myself have 3 daughters studying at home every day. And it's been a circus, honestly. But this is what we've been going through. We've gone through so much. This is not time to let down our guard, because we've heard so many stories. It's all it takes is one time, meeting of a family, eating a nice dinner together, let your mask down, and things get spread. So please, the most important message I can provide to you today is please hunker down for a little bit more. We're talking about a few months more, and hopefully once this vaccine is here, and we will do our best to work with not just Santa Clara County hospitals, but also our partners over at PAMP, at Kaiser, and I also talked to the Kaiser representative yesterday regarding what they're doing over at their Santa Clara center over by Lawrence Expressway. And they are really ramping up of their vaccinations as well. I'm truly excited about that, and along with PAMP, we will be able to beat this. We will get the vaccinations out. And please, I'm going to ask also to be a little bit patient. We've got a lot of mixed messages. As of Tuesday, we heard that the age was 75 years old from the county, and the next thing we know is the state came out and say 65. So there's a lot of these mixed messages going on. Just to clarify, for the Santa Clara County system, we are only doing 75 and above right now. But for Kaiser, they are doing some limited 65 and above. But at the end of the day, it's about how much vaccines we are being given that we could give out. And we're doing absolutely the fastest we can to make this happen. So again, thank you very much for being here. Thank you for hunkering down. Thank you for helping us on this fight. And we will be able to beat this soon. Looking forward to the new administration coming in. And we are really expecting some good news down the road, as new President-elect Biden has talked about 100 million vaccines in the first 100 days in office. And we'll hold him accountable to make sure that happens. Thank you very much.
We'll now go to questions and answers. We will start with ABC 7.
Who did you get that information from?
Oh, the same kind of national reporting that everyone else has been seeing. You know, we often learn about what's happening at the federal level the same way all of you do. That's kind of the way the system is. these days with this federal administration, unfortunately.
We have not heard anything from the state yet directly in regards to that news.
No, we have not.
Thank you. NBC?
That we get is spoken for because it's based on first doses administered. And we are already administering second doses. We're actually very pleased that those folks who were able to get first doses at the beginning, mainly people working in our acute care hospitals, are now getting their second doses under that timeline. But it's important, once we administer our first dose to somebody, we've got to make sure we've got that second dose there a month later so that they can get it at the right time in order to have the efficacy. Now we're a little hopeful. We're seeing the same news I think all of you are, that there might be some other vaccines that might come on the market in the coming months that may only require one dose, and that would help a lot.
So to clarify, the last time I kind of checked the website, it was about 170,000 doses split between first and second that had arrived and been allocated to the county. Is that the total universe of vaccine that has come in? Because you've always talked about healthcare systems get theirs straight from the state, CVS and Walgreens get them straight from the Fed. So I'm just trying to kind of clarify numbers.
Yeah, so it's a great question. The question is the numbers that we have available, what do they reflect? And the answer is it's incomplete data. So we only know some of the allocations that are coming in to providers in the county, and we're able to have them report some of that information to us. But let me explain a little bit further. So we are going to get some data from them related to doses administered here in the county, but that information is still, we're not confident is complete. And so that's partial information. We don't know how much vaccine has come into the county and is being administered by other federal providers like the VA hospital, for example, which we understand is providing vaccine to Santa Clara County residents who are VA patients. So there's a lot that we just don't know yet, and we certainly hope that we'll get a more complete picture, because at the end of the day, we need to have assurance that all of our residents have access to and are able to get vaccinated. But the crux of the challenge with that is the majority of our residents are patients of Kaiser and PAMF alone, and those are entities that are receiving direct state allocation.
Do you want, or can you imagine a change in the system in which the county is sort of the spoke of the wheel, and everything kind of is either comes in or is coordinated through you, because it seems like there's just a lot of parts of this machinery that you don't have control over.
So the question is about coordination or control through the county. I think the key is, which is a great thing, people want to get vaccinated, and so when open to 65 and up population, that's such a large population in our county, that's well over 300,000 individuals. And so I think that's why you saw that their systems go down. But the reality is we have nowhere near that amount of vaccine here to deliver. And so we're seeing demand outstrip supply. We're seeing demand outstrip basic capacity, like some people's websites for scheduling.
Back center.
Do you consider of releasing the reserve for second dose to be part of the first dose? I know our Orange County supervisor is talking about that, because there's enough lag time so that you will have more vaccine coming down from Moderna and Pfizer. So is that a possible strategy?
So the question is about reserve for second dose. And this is where we really need a lot more clarity from the federal government primarily, but also from the state. We were under the understanding until today that the federal government had second dose supply that they were holding to push down. They said earlier this week they were going to then distribute that. Now we've learned that we're working to stand up a whole number of other sites. Dr. Tong mentioned we're going to be standing up a site in Mountain View area. We're going to continue to expand capacity. We've got 2 mass vaccination sites that are already open. So the capacity is going to continue to increase, but the real issue isn't that, it's the vaccine supply.
Go to NBC.
So I understand what problems this is all causing, but why is it happening? What's the advantage in entities not sharing information? Why isn't the county being told so directly by federal? Why is there this disconnect? What's the advantage in them operating this way versus everybody being on the same team?
So the question is, what's the advantage in, I'll just call it the chaos of the information flow. I don't think anyone thinks there's any advantage. But I think you should probably ask your question of some of these other systems, of the state and the federal government. I think maybe the fairest thing to say is I think the Trump administration's been a little distracted. They've been more focused on the election results and stirring up crowds. We saw the horrific events at the Capitol. This is a moment when we should be all singularly focused on dealing with the raging pandemic. Supervisor Lee pointed out we're in the middle of the worst surge. We need to be focused on that, and we need to be focused on the vaccinations. Unfortunately, the Trump administration has chosen to instead spend months focusing on discredited, false, frankly, absolutely horrific objections to, a free, fair election. And that's, I think, really distracted the energy of the federal government from its first and foremost job, which is to protect and take care of everyone here in the United States.
Go to KPIX.
So you guys have been working to accelerate the efforts to get people their shots. With this supply issue, how real is the risk that you may either run out or have to sort of throttle back those efforts?
Because of, like I said, all the information challenges that we're having. But, we schedule out in advance. We've scheduled out next week. We've scheduled out appointments even beyond then. And so everything we've got is more than spoken for.
Roughly 6,000 a day. How many, what's the date that's circled if nothing comes out and cupboards are bare?
So the question is the date that's circled. Well, it's a moving target because we continue to ramp up capacity. We're not static at 6,000 a day. We're going to keep growing and growing and growing that capacity at the county health system, and we know every other provider is going to be growing their capacity too. So that date is going to keep moving up unless we get more supply coming in.
We'll go final question from ABC. So how soon do you think you'll be able to get more of that data?
Is the 170,000 number just the Santa Clara health system, or is it other providers? It includes other providers, but it's incomplete. So it includes, for example, Vaccine Stanford has, I know that for sure. So it definitely includes other providers and not just the county health system, but it's still incomplete data. The first part of the question was, with the health order that was issued last week, to try to obtain this kind of data and also to require the large systems to submit comprehensive plans, when do we think we'll have a better picture, or what might that look like? We do have surveys out already under that health order to the systems to report the data. We're starting to get that data in, but it has to be validated. We have to make sure people are answering the queries the right way, with the right definitions, and so forth. So I think we'll have a lot more very, very soon because we have some preliminary information that's just dirty. But not everything is still going to come from that. For example, the federal government isn't subject to a local health order. And so certain federal supplies like the VA hospital, we hope that they will provide us that information, but we cannot legally compel them to. And so some of these pieces are still potentially going to be missing for us, and that's a huge challenge. Like I said, at the end of the day, our goal here is 85% of the eligible population vaccinated by August 1. That's our big picture goal. And for the vaccines that need 2 doses, that means 2 doses. But we can only know where we're going there, right, if we know what's happening for all of our residents, and when the majority of our residents are the patients of these other systems, that's just a big challenge. But we'll get through it. We'll figure it out. I think the takeaway I have when I go home at night is, this vaccination piece of this pandemic is a hopeful piece. It's challenging right now. It's frustrating right now. Believe me, it is extraordinarily frustrating for us, but it's also a hopeful piece.
Vacunas a nuestra comunidad. Este sitio tendrá la capacidad de 1,300 personas por día. Esto está basado también en el número que tenemos para los terrenos de la feria, que actualmente son 1,800 por día. La meta, o con estos esfuerzos, la idea es llegar a poder vacunar a más de 6,000 personas por día. El equivalente sería como alrededor de 30,000 personas por semana. Más adelante estaremos también expandiendo nuevas áreas o nuevas locaciones en las cuales estaremos poniendo la vacuna contra el COVID-19, incluyendo una locación en la ciudad de Mountain View. Seguimos buscando nuevas locaciones y seguimos ampliando donde podemos poner las vacunas. También queremos recordarle a la comunidad que actualmente estamos en la fase 1A y la gente que son mayores de 75 años también ya se pueden poner la vacuna. Sabemos que el Estado hizo un anuncio en días pasados que permite a las personas 65 años y mayores a recibir la vacuna. Debido a la escasez y el límite de número que tenemos de las dosis de vacunas, en el condado de Santa Clara solamente estamos administrando a personas que califiquen bajo la fase 1A y también aquellas personas que son mayores de 75 años. Sabemos también que hospitales como Kaiser ya están vacunando a ciertas personas que son 65 y mayores. La diferencia aquí es que hospitales como Kaiser reciben sus vacunas o el número de vacunas directamente del Estado. El condado de Santa Clara recibe también sus vacunas del Estado, pero son dos diferentes formas de distribución. Aquí queremos seguir reforzando que ya se puede poner la vacuna a aquellas personas que tienen más de 75 años. Si usted califica actualmente durante la fase 1A o porque es mayor de 75 años y necesita hacer una cita, por favor visite nuestra página web en www.sccfreevax.org. Ese es nuestro sitio web y ahí usted va a encontrar los links o los enlaces para aquellas locaciones dependiendo a su proveedor médico. También les queremos recordar que seguimos en la fase A y que también ahorita hay ciertos hospitales como Kaiser Permanente que sí pueden poner la vacuna a las personas que tienen 65 años o más. Y por último, le queremos recordar a nuestra comunidad que mientras las vacunas ya están siendo administradas, esto todavía no podemos bajar la guardia. Le estamos pidiendo que por favor sigan usando sus tapabocas, sus cubrebocas, manteniendo ese distanciamiento social de más de 6 pies. Por favor, digan no a las reuniones y también recordarles que aún seguimos bajo el encierro preventivo bajo el estado de California. Muchas gracias.
Al parecer California está atrasado, que todos los demás, ¿será que de verdad es un problema con el sistema? ¿Qué es lo que pasó detrás de bambalinas? ¿Qué se sabe?
Hasta ahorita lo que sabemos es de que el número de vacunas que estamos recibiendo de parte del Estado es limitado. Mientras el Estado acaba de anunciar en días pasados que las personas de 65 años y mayores ya pueden obtener la vacuna, el problema que estamos teniendo aquí en el condado de Santa Clara es de que no tenemos suficientes vacunas. Estamos esperando que el Estado nos siga mandando más y esto está cambiando día por día. Es por eso que le estamos queriendo recordar a la comunidad que para la información más actualizada, que por favor visite nuestro sitio web.
¿Cuál es el problema? Porque al estar hablando con todos los departamentos de salud constantemente, nos damos cuenta como que todos van a las ciegas, o sea, no hay mucha instrucción, tanto estatal o federal. ¿Qué es lo que está pasando? ¿Quisieran tal vez recibir más apoyo del Estado o federalmente, los departamentos de salud locales?
Así es, estamos esperando recibir más apoyo del Estado, tanto como del gobierno federal. En este caso sería a saber cuáles son los planes de distribución de las vacunas. Estábamos enterados de recientes días pasados que el gobierno federal estaba teniendo una reserva de vacunas para la segunda dosis. El día de hoy nos enteramos que esa reserva no existe. Nos enteramos también de que como esta reserva no existe, que supuestamente ya fue distribuida. Es ahí donde estamos teniendo problemas porque eso nos está limitando a nosotros en seguir vacunando a la población aquí en el condado de Santa Clara. Sabemos también que mientras continuamos con los esfuerzos de expandir las locaciones donde podamos administrar la vacuna, las locaciones hasta este momento no han sido un problema, más sin embargo, una vez más, el problema que estamos enfrentando aquí es el número limitado de vacunas que tenemos disponibles aquí en el condado.
Al gobierno federal de que ustedes están queriendo hacer el trabajo, pero necesitan su ayuda.
Así es, no solamente somos nosotros aquí en el condado de Santa Clara quienes están enfrentando este problema, pero lo estamos enfrentando en otras partes de California también, y los cuales estamos comunicando esto también les estamos haciendo este llamado que por favor nos prueben las vacunas necesarias para seguir vacunando.
Eso ahora mismo, me están diciendo feedbacks de ese website, exactamente cómo es que funciona y qué es lo que la gente tiene que hacer.
Así es, pues si las personas ya califican para ponerse la vacuna, ya sea que califiquen bajo la fase 1A porque trabajan en el servicio médico, o si ya son mayores de 75 años o tienen un familiar que es mayor de 75 años, pueden ir a la página web. En esta página web hay diferentes opciones dependiendo cuál sea su proveedor médico. Sabemos que mucha gente en nuestra comunidad tal vez no tenga proveedor médico o no tenga aseguranza. Les queremos recordar que la gente puede acudir a esta website y no importa su estatus migratorio y no se les va a cobrar. Allí ustedes van a poder dar clic en el enlace donde van a tener que llenar un cuestionario para verificar que están cumpliendo con todos los requisitos necesarios para obtener la vacuna. Después de que ese cuestionario es completado, se les llevará a otra página web en la cual se les va a poder hacer la cita dependiendo de la locación que tenga la disponibilidad basado en la fecha. Ya de ahí la gente puede venir a la locación, ponerse la vacuna, y allí es cuando la persona va a recibir una tarjetita en la cual le va a marcar la fecha donde se puso la primera dosis, y la segunda dosis se tendrá que poner en 3 semanas más tarde.
En las próximas fases, ¿hay algún formulario para ellos llenar o todavía no?
En el condado de Santa Clara, sabemos que otros condados en el área de la bahía han estado llenando un cuestionario para que sean informados cuando la segunda fase entre. Aquí en el condado de Santa Clara lo que estamos haciendo, estamos trabajando con nuestras agencias comunitarias, con los medios de comunicación, con las redes sociales y con nuestra página web para asegurarnos de que esta información vaya directamente a las personas y estén enteradas cuando el siguiente grupo, como que en este caso sería el grupo o la fase 1B, estarán disponibles. Ahorita es muy difícil contestar esta pregunta debido a el límite de vacunas que tenemos aquí en el condado. Sabemos que son alrededor, tenemos un número muy alto de personas que trabajan en la industria de salud o médica, y más aparte las personas que ahora estamos vacunando, que son 75 y mayores. Aquellas personas quienes quieran ponerse la vacuna, no importa su estatus migratorio y no tendrá ningún costo alguno y tampoco necesita tener aseguranza médica. Estamos ahorita abriendo esta locación que se abrió el día martes, tenemos los terrenos de la feria, tenemos otras clínicas que son parte del sistema de salud del condado de Santa Clara, que también ya están aplicando las vacunas, y próximamente también estaremos expandiéndonos a la ciudad de Mountain View y estaremos buscando por nuevos sitios en el este de San José y Gilroy.
¿Tienen computadora para firmar, para hacer el formulario? ¿Pueden llegar directamente?
Las personas que no tengan acceso a una computadora o no puedan hacer completar este formulario vía electrónica, habrá un número telefónico en el cual ellos podrán llamar para que una persona o un operador les pueda ayudar a completar estas citas. Ahorita la gente puede llamar al 211 para obtener más información y que puedan proveerle la ayuda necesaria. Vamos a estar trabajando con los operadores del 211 para que puedan transferir las llamadas acordadamente.
Xin chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Ngày hôm nay, quận hạt Santa Clara đã mở ra một cuộc họp báo để đưa đến cho quý vị những thông tin về việc mở rộng việc chủng ngừa, mở rộng các địa điểm chủng ngừa để đưa đến việc chủng ngừa cho quý vị dễ dàng hơn. Quý vị có thể đi đến những cái địa điểm chủng ngừa gần hơn. Kính thưa quý vị, chỉ tính trong cái hệ thống Valley Medical Center thôi thì chúng tôi có 5 địa điểm đưa đến chủng ngừa cho quý vị. Trong đó có 2 địa điểm lớn là một địa điểm ở Fairground và một địa điểm ở Burger Drive. Trong cái tuần này thôi thì chúng tôi đã đưa đến hơn 15.000 chủng ngừa Covid-19 cho quý vị đồng hương. Những việc mà cho phép chủng ngừa là hoàn toàn là về phía bên mình sẽ đi theo hướng dẫn của tiểu bang và liên bang. Tuy nhiên thì mỗi quận hạt họ sẽ có được những cái lượng thuốc chủng ngừa mà họ đang có sẵn, thì họ phải xem xét cái việc đó để họ đưa ra những cái chỉ tiêu riêng cho cái quận hạt của họ. Thì đối với cái quận hạt của mình bởi vì mình vẫn chưa được nhận thêm thuốc chủng ngừa từ bên phía tiểu bang, thành ra là mình chỉ có bao nhiêu thuốc chủng ngừa đó từ trước tới nay thôi là tầm khoảng 166.000 liều thuốc chủng ngừa. Thành ra là quận hạt của mình chỉ cho phép là những người trong giai đoạn 1A và những người từ 75 tuổi trở lên mà thôi. Tuy nhiên thì những cái hệ thống bệnh viện lớn như là Kaiser, Stanford hay là Palo Alto Medical Foundation thì những hệ thống lớn này họ nhận được những cái liều thuốc chủng ngừa trực tiếp từ liên bang và tiểu bang. Thành ra là họ sẽ xem xét thử coi là cái khả năng cung cấp chủng ngừa của họ có cho phép hay không, cái lượng thuốc mà họ đang dự trữ có cho phép hay không, thì họ có quyền mở rộng ra như là hướng dẫn của tiểu bang đưa ra. Thì ngay tại thời điểm này thì cái bệnh viện hệ thống bệnh viện của Kaiser đã cho phép chủng ngừa cho những người hộ đủ điều kiện trong giai đoạn 1A và những người từ 65 tuổi trở lên. Thành ra là Khánh Ly muốn đưa đến cái điều này cho quý vị để quý vị không có bị confused nữa. Thì nếu như mà quý vị là những cái thành viên mà thuộc hệ thống Kaiser, Stanford hay là Palo Alto Medical Foundation thì quý vị hãy gọi điện cho cái hệ thống bảo hiểm của mình, hệ thống bệnh viện của mình để quý vị có thể đặt hẹn chủng ngừa và quý vị có thể lấy hẹn một cách dễ dàng nhất. Và nếu như mà quý vị không có bảo hiểm y tế và quý vị hoặc là quý vị thuộc cái hệ thống bảo hiểm của quận hạt thì quý vị hãy gọi hãy lên đặt hẹn qua cái hệ thống là Valley Medical Center để quý vị có thể đặt hẹn chủng ngừa cho mình. Dạo gần đây thì Khánh Ly trong quận hạt cũng nhận được những cái báo cáo vi phạm về việc là có những người nhận được những cái text message hoặc là những cái cuộc gọi và nói rằng là họ nhận cái waiting list là danh sách chờ để đặt hẹn chủng ngừa và họ cũng lấy cái thông tin cá nhân của quý vị. Thì Khánh Ly xin nhắc lại một lần nữa là chúng tôi cung cấp việc xét nghiệm hoàn toàn miễn phí, cung cấp việc cái chủng ngừa Covid-19 là hoàn toàn miễn phí và mọi cái thông tin chủng ngừa sẽ được có trên trang mạng là sccfreevax.org và trang web này đã được dịch ra bằng tiếng Việt, cho nên quý vị có thể rất là dễ dàng để có thể tìm được cái thông tin cần thiết. Thành ra là quý vị đừng đưa cái thông tin cá nhân của mình cho bất kỳ ai vì họ có thể ăn cắp cái thông tin của quý vị và họ có thể đi vào cái thẻ ngân hàng của quý vị để ăn cắp tiền. Thành ra là hãy lưu ý điều này. Chúng tôi chúc quý vị thật nhiều sức khỏe và xin cảm ơn.
大家好，我是圣塔克拉拉县紧急行动中心的 Ann Chang。今天记者会主要是向大家提供新冠疫苗的更新和扩增新冠疫苗施打地点的讯息。县政府呢已经加快疫苗执行的速度，光是县所属的医疗系统就已经有5个疫苗接种地点了，包括了 Fairgrounds 和 Burger 2个大型的疫苗站。在这周，截至目前已经执行了超过15000剂的疫苗，还有超过6000人预约。今天呢，还有超过6000人预约接受疫苗的施打，而圣县医疗系统已经执行了超过32000剂的第1剂的疫苗。在扩展疫苗执行速度之后呢，每周可以为3万民众施打疫苗。 加州政府已经授权大型医疗系统，除了前线的医疗人员之外，可以开始为65岁或以上的人士施打疫苗。但是由于疫苗数量的不足，圣塔克拉拉县尚未跟进，目前只开放75岁和以上的人士预约。但一些县内的跨县大型医疗提供方，像是 Kaiser， 已经开始为他们部分65岁或以上的会员接种。至于哪些人在哪个阶段符合条件施打，都是由联邦和加州的政府所制定的，县政府呢只是遵循这个指令来执行。我们鼓励有医疗保险的民众可以先透过自己的家庭医生来寻求疫苗的接种。如果联邦和加州政府呢发布更多指引，还有符合疫苗接种条件的讯息，县政府都会在第一时间向大家宣布。由于讯息更新非常的快速，大家可以通过圣县的疫苗官方网站 sccfreevax.org 来了解任何跟疫苗有关的讯息。这个网站呢会定期的更新，来反映目前哪些社区成员符合接种疫苗的条件，还有如何预约的讯息。请大家继续防疫，随时勤洗手、戴口罩、保持社交距离。祝大家平安健康，谢谢。
Magandang umaga mga kababayan. Ako po ay si Jimbel Batuampo, Public Information Officer ng Santa Clara County. Nandito kami ngayon upang ipaalam sa inyo ang pagpapalawak ng mga lokasyon sa pagbabakuna at ng kapasidad para sa pagbabakuna sa buong county. Ang Santa Clara Valley Medical Center ay nagbabakuna ng higit sa 6,000 na mga residente bawat araw. Ang ating VMC na sistema ay tumatag ng 5 lokasyon sa pagbabakuna kabilang ang 2 maramihang lokasyon sa pagbabakuna tulad ng sa Burger at Fairgrounds. Ang mga lokasyon ng SCVMC ay nagbabakuna ng sinumang manggagawa sa healthcare sa yugto 1A, pati na rin ang mga individual na lampas edad 75. Pumunta sa sccfreevax.org para mag-schedule ng appointment. Ang estado ng California ay nagbibigay ngayon ng otorisasyon sa lahat ng mga sistema ng healthcare sa buong estado na magbakuna ng sinumang tao na may edad 75 at mas matanda, bilang karagdagan sa patuloy na pagbabakuna ng mga manggagawa sa healthcare at residente ng mga long-term care facility. Ang impormasyon ay mabilis na nagbabago. Ang SCC Free Vax Action ang buong komunidad. Ang inyong individual na aksyon ay mahalaga at makapag-iba sa direksyon ng pandemya. Palaging tandaan na panatilihin ang pagdistansya sa ibang tao at magsuot ng maskara kapag wala sa bahay at manatili sa bahay maliban sa mga mahalagang aktibidad. Ang website ng county sa sccfreevax.org ay ang opisyal na source para sa impormasyon na nauugnay sa bakuna sa Santa Clara County at regular na in-update upang ipakita kung sino sa mga membro ng komunidad ang kasalukuyang kwalipikado para makatanggap ng bakuna, pati na rin kung paano ang mga individual na iyon ay makapag-schedule ng mga appointment. Maraming salamat.